everyone. Generally, when we say about the therapies, we think it's only the center-based sessions. So when it's a center-based session, definitely we have its own positives of having the child face-to-face. You will be able to understand the child in a much better way. You can read the behavioral cues of the child in a much better position. But with the COVID, the online therapies have increased a lot. In fact, even before the COVID, we used to have online therapies, but we used to offer it more for the people who are staying in the overseas. So they used to come to India, take sessions for 3 months or 4 months, and post that we used to continue using the online therapies. But with the COVID, we are seeing a lot of requests coming up for the online sessions. It could be because of the apprehensions getting the child outside, or it could be due to the remote areas, or there are certain places in India where we don't have option for a center-based therapies. This is Dr. Jyotsna Thanigundala from Daffodils Child Development Center, Hyderabad. We got a request recently stating that, "Ma'am, we don't have offline therapy centers near our locality. My child is around 18 months and he has been diagnosed with virtual autism. Doctor has suggested us to start with occupational and speech therapies. Can we opt for online therapy, and can you please suggest on it?" So especially in your case, I'm very happy that your pediatrician could diagnose or at least identify the at-risk baby at very young age, that is 18 months. And we should be very happy that you are a very keen observer. Unless you come up with the signs and symptoms, it would be difficult for a professional to look at the signs and symptoms within the 5 minutes of a pediatric evaluation. So, kudos to your doctor and kudos to the parents. And next, when it comes to the online therapies, definitely when there is no possibility of center-based therapies, the next option we have is online therapies. But before commencing for the online therapy, it is always suggestible to take the child at least for 2 weeks to the place where they could give a center-based therapies, and at least for the evaluations. So unless we see the child on the first hand, we don't know what all signs and symptoms the kid is exhibiting and where is the baseline of the child. So it's not only the diagnosis or labeling which we look at when we need to treat the child, but we have to give more importance to the baseline of the child, what skill he knows and what skill he doesn't know, and whether that skill is typical to his age or is it away from the curve. There would be certain amount of atypical skills also which a child might develop. When we say atypical, it is definitely not seen in all the children, but only few children might be exhibiting such symptoms. So if the child comes to us for the evaluation, so the evaluation itself goes on for a detailed 45 minutes, at times even to 1.5 hours. And after that, there would be something called observation sessions where we will be understanding child from his own perspective. Initially, during the first evaluation time, we will be knowing your child from your perspective, but when it comes to observation, we get a chance to understand from his own perspective. That's how you make a baseline. Once the baseline is done, then comes the question of online or the offline therapies. So even if you doesn't have option for the center-based therapies or the offline therapies, then the next option definitely is to choose for the online, because it's not important just to diagnose and leave the child. We have to do some early interventions after diagnosing the child, and we all know that early intervention is the only key for the later success. So this early intervention, you can start with the online. There is nothing wrong in it, but start after understanding the baseline of the child. In the online session also, every unit or every center will have their own rules and regulations for it. Generally at Daffodils, when we say online therapies, it would be more like a parent training. So wherein we use the parent as a shadow therapist. Screen has to be placed at a level so the child should not see the screen, but our therapist should be able to see the child. And all the instructions will be given only to the parent. We prefer parent to put on headphones or the Bluetooth earphones so that you can keep hearing our voice and our commands, and you are the one who are going to give command to the child. So that's how we conduct the online sessions. So that's the reason before starting the online sessions, definitely we recommend for evaluation and then the observation session to understand the baseline of the child. And then parents should get tuned to your therapist. They should start understanding what the activities are and how to implement the activities. So the basic psychoeducation to the parent is very important. Once these prerequisites are done, then we can officially start the online therapies. And always remember that in online therapies, parent is the key role, or he plays the pivotal role in conducting the session. Always instruction has to come to the parent and parent has to deliver it to the child. So not child looking at the screen and your therapist taking therapy directly from the screen. So every therapy will have its own pros and cons. As I explained the pros of the center-based therapies, online therapies also have a pros, because here, since the parent is getting trained on a first-hand basis, even after the session, parent will have an adequate knowledge to stimulate the child in a similar terms. So you can definitely elicit good responses from the child even from the online sessions, only when the prerequisites are settled and only when the parent is highly motivated and who is in a position to change themselves as a shadow therapist and work for the child. So there is nothing wrong in opting for online sessions. In your case, since the child is at 18 months, please do utilize this critical age for development. Start with the online sessions and start stimulating the child as many hours as possible at home in the most naturalistic way as possible. Thank you so much. If you still have further questions, please reach us at 833-297-1624. Thank you.